Men with erectile dysfunction, or ED, have ongoing problems getting and keeping an erection that is firm enough for intercourse. A vacuum erectile device, or VED, is used to help men with erectile dysfunction get and maintain an erection. VED is also used to preserve penile length and for stretching your penis to treat men with Peyronie's disease. A VED consists of the following: a plastic tube, a mechanical, battery-operated, or electric pump, and a constriction band that fits on one end of the tube. The tube is placed over the penis, and the pump is used to create a vacuum, which draws blood into the penis so that it becomes erect. If you are using it for sexual activity, the band is placed at the base of the penis to help maintain the erection. The VED works by creating negative pressure in a cylinder surrounding your penis and safely drawing blood into your penis, resulting in an erection. Use of vacuum erection devices for stretching the penis during your penile rehabilitation. As part of your penile rehabilitation, in addition to PDE5I or ICI treatment, or for stretching your penis due to Peyronie's disease, I recommend using a VED to help you stretch your penis and preserve penile length. I recommend using the VED once a day. Start with 3 pumps and wait 5 seconds until pressure starts building up. For the next 3 pumps, wait 10 seconds until pressure increases. Add 3 pumps more and wait 15 to 20 seconds. You can add more pumps, one at a time, as needed for a stronger erection, and wait for pressure to build up in between pumps. Once a firm erection has been reached, keep it for 1 to 3 minutes and then release the pressure to allow air to release from the cylinder. Let the penis relax for 1 to 2 minutes and repeat 5 times. Each therapy session typically lasts approximately 20 to 30 minutes. It is recommended that you shave your pubic hair to create a better seal and help prevent hairs from getting caught in the rubber adapter or constriction ring. Never combine VED with injection therapy at the same time to get erections. This can increase the risk of prolonged erections. Use of vacuum erection device with constriction bands for erectile dysfunction. As part of your erectile dysfunction treatment, I am recommending using a VED and constriction band with the purpose of helping you obtain and maintain an erection. The VED can be used in addition to PDE5I pills or penile injections if indicated. Most VEDs work in a similar fashion. If your model comes with a cone, before you start, ensure that you attach the cone to the opposite side of the cylinder where the penile adapter is located and apply a small amount of water-soluble lubricant to it. If your VED comes with constriction bands, insert the small, medium, or large band through the cone and slide it up to the base of the cylinder, stopping at the level of the penile adapter. Once the band is on cylinder, detach the cone and insert penile adapter. Apply water-soluble lubricant to the base of your penis and adapter, and insert penis into the pump through the adapter. It is recommended that you shave your pubic hair to create a better seal and help prevent hairs from getting caught in the adapter or constriction band. Press vacuum towards your body and start pumping. Start with 3 pumps and wait 5 seconds until pressure starts building up. For the next 3 pumps, wait 10 seconds until pressure increases. Add 3 pumps more and wait 15 to 20 seconds. You can add more pumps, one at a time, as needed for a stronger erection, and wait for pressure to build up in between pumps. Once desirable erection has been reached, slide off the constriction band from the cylinder down to the base of your penis. This will help you sustain a firm erection. You can use the band up to a maximum of 30 minutes. Afterwards, hold the band from the side taps and pull it away from your body to allow it to deflate. Side effects. The most common side effects occurring with the use of VEDs are penile numbness, no ejaculation, bruising or swelling of the penis, and difficulty achieving orgasm. Penile discoloration can also occur because the erection obtained with the VED is not naturally obtained, giving your penis a slight purplish color. These symptoms tend to disappear once you stop using the pump. Too much air pressure in the cylinder can also cause mild bleeding under the skin surface. Please make sure to tell your doctor if you have a history of blood disorders, blood clots, or take blood thinners. VED is not recommended if you're taking any anticoagulant medication due to the higher risk of bruises and hematoma. Thank you so much for watching the video. Please share it, give me a like, and subscribe. See you in my next video.